Good afternoon, dear students. How are you? I hope things are fine and you're enjoying your these days. I know these days are difficult, but we have to cope up. This is how things are. So today we are learning the parotid gland. Parotid gland, for learning this parotid gland, my objectives are here, and today we have to establish the structures who are closely related to this gland, its innervation and its different supplies, and when the gland has some disease processes, what kind of situations are there. So now to understand, first I have brought up a picture for you. So just tell me what you're looking in this picture. Can you guess on this picture? Yes, you're right. You can see a scar mark which is just shown under the ear, and that is marked with a black arrow. Now, what's the big deal? Why I'm showing this here? Can you look in the same person? What happened? His face, look at it. There are some changes. So what's that thing? Is it really hot? Do you find hot in across you? No. Is it something wrong? So that's what we are supposed to learn today, that what are the different things which are associated and related. So now, as we know, the parotid gland is one of the major salivary gland in human body, and it's responsible for secretions of saliva. The rest of the details you can read through the slide. Now, this gland, if you look at it, it's pyramidal in shape, and it has, as you can see in this section, and this section is showing very clearly, it has a superficial part and it has a deep part. Before that, it has an apex and base, which has not been shown in this section. So now this gland, as I said to you, it has a superficial part. Superficial means it's under the skin. So under the skin, we have different structures which are supposed to be there. And then the deeper part is having, you can see that the anterior aspect, we call it anterior medial because it's looking inwards. And then it has a posterior medial surface. So these are the components of the deep surface or the deeper part of this gland. Looking further, this gland, as you can see from this image, it has an anterior border, a posterior border, and a medial border. So these borders has been shown. So let's see in more detail. Now let's look at this gland. It's been situated, as we talked about, you can see that it is located under the ear and just on the side of your face, in front of the sternocleidomastoid muscle, and you can see the muscles is been just going behind, and in front you can see the masseter muscle is there, and in the bottom part, in the lower part, you can see there are deep structures of the neck which has been shown. You can see there is submandibular gland which is visible, and some venous structure has been shown. Let's go further. Now this is what exactly what I was talking about. So this is what I'm showing you, what the bed of the parotid gland. So what is this term, bed of the parotid gland? So you can see that this red margin which has been marked, that is showing us the location where this parotid gland has been located. And as we talked about, you can see behind is shown the sternocleidomastoid. In front you can see the masseter muscle, and then on top you can see there's the ramus of the mandible, and down there are deep structures. The posterior belly of digastric muscle is being very clearly shown up. So this is what you're looking at. This is how it has been located. So let's zoom in. So we can see that this gland, now it fits in its bed, and you can see all across this gland, the different neurovascular structures are radiating outwards or inwards. So they are going in and out. And then you can see on top, you can see this external acoustic meatus is being shown. And down, this is the apex, and there you can see an inverted V is being showing some vein which has been emerging out. And we need to look into these details shortly. Now going further, when we look at it, so this is what is being explained, how these structures has been surrounding and emerging out of this gland. Now this gland you can see is being placed on the face, and inside this dotted area is just showing a very important nerve. This is nothing but my seventh cranial nerve or the facial nerve, and this nerve is important and we need to know about it. And you can see that this nerve is being piercing through the substance of this gland. We need to talk about it in detail. Now you can see that how this nerve is just been clasping the different parts and the lobes of this gland, and this you're looking at how it is surrounding, and this is the inner aspect, how this gland is being enclosed, is being surrounded. And now this slide is because we are looking at what this green stuff, the green structure is just the investing layer of my cervical fascia, which surround this gland. That's why when people have inflammation of this gland, the gland is being trapped and it causes significant pain. And then this is, and in the inflammatory condition, this pain, it becomes so unbearable. And that we'll be talking a little bit today. Now we are here, I'm showing you a section of a human face, and the human face is being cut in a transverse way, and we are looking in a zone which is being shown here. It's a wedge type of thing, and we talk about this is nothing but my parotid gland. And you can see that we talk about it has a superficial part and it has a deep part. We talk about the deep part has an anterior medial and posterior medial surface, and then we can see that these are the borders which we talk about: anterior border, posterior border, and medial border. Let's look further in this. Now we can see that this outline has been marked with this red marking line. And now let's see when, and you can see in front of this gland, there I can see this is my part of my mandible bone, and this part of the mandible bone is called ramus. And you can see that on both sides of this ramus of the mandible, you can see these muscles, and these muscles are what we can see here. We can see that this is the same thing, my mandible, and you can see the medial pterygoid muscle and the masseter muscle. What are these muscles? These are the masticatory muscle. In the session, which we'll be having tomorrow in the infratemporal region, we'll talk about that. And posteriorly, we can see that to the posterior, this was the anterior medial border, and this is the posterior medial border. And there you can see that the posterior belly of the digastric on the inner aspect, and this is the mastoid bone. And then on the outer surface of this mastoid bone, you're looking at the sternocleidomastoid muscle. And as I was talking before, so this section is being taken at this level. And now what you can see there, this wavy structure which runs through all the way, that's nothing but the facial nerve which is going through this. And then we are looking at a venous structure and an arterial structure. This is retromandibular vein, and this is my external carotid artery. It's bifurcating place. And then most medially, we can see that there are some structures which are being, this is what my carotid sheath. And as we know, the carotid sheath contains what it has. You can see that the internal jugular vein, you're looking at the internal carotid artery, and you're looking at few of my cranial nerves which has been shown. And we can see further detail of this section. Now we can look into that, and you can see a lot more is being visible here. We can all see that to the anterior medial border, the ramus of the mandible and the muscles who are attached on both the sides. And innermost aspect, we can see the pharyngeal wall which has been shown in this image. Now here we are looking at the posteriorly, we talk about the mastoid process, we talk about the digastric muscle, we talk about the sternocleidomastoid. And now we can see further, these are the structures which has been enclosed in the carotid sheath. And there is what? This is the styloid process. I call it styloid apparatus because towards this styloid process, we have these structures which are attached to my styloid process, and we need to be good at it. Now, if we come to the superficial part of this gland, we can see that within this gland, this green line is showing the basically the fascia. And then you can see the skin, and under the skin, we can see this superficial tissue. So that has all been shown, and this is how, and there you can see these are the lymph nodes which are just present on the under the superficial surface or on the outer surface of this gland. Now let's look further. There is another image of the same description which we are talking about. This is just revision of the same what we talk about. We said anteriorly we have the ramus of the mandible, and then we are looking at the masseter and the medial pterygoid muscles. And posteriorly we are looking at the mastoid process, and then the digastric muscle. It has, why is it called digastric? Because it has two bellies. And then you can see this is the posterior belly of digastric. And here what we are looking at the posterior belly of digastric, and this is sternocleidomastoid. And now anteriorly we talk about what are these two things. This is basically, these are the two structures which runs within the ramus of the mandible. We'll talk about these structures when we'll be talking about infratemporal fossa. Now if we coming to the medial border, further down we can see the styloid process across my posterior medial border, and then the structures which are attached to it. My nerves, you can see that they are arranged in a sequence. There is the carotid sheath, and you can see the ingredients of that. And then you're looking at the oropharynx. And this exactly tells you where is anterior, where is posterior, where is lateral, where is medial. Guys, this image is so important, and you are expected to be the best with this. These relations are really, really meaningful. And I can re-emphasize on that. This is a superficial surface, and these are the deep surfaces. And the deep surface, we have anterior medial, and this is the posterior medial part. And then you're looking at the anterior border, you're looking at the posterior border, and you're looking at the medial border. I hope things are fine. If there is anything which is bothering you, please feel free to communicate to me. You can write an email. I'll be back to you. And in Zoom session, we'll be talking in more detail. I expect your questions. Now, the same image, the same concept has been you can see that I spent 4 slides talking of the same stuff. So you can anticipate how important is this to understand how this parotid gland is being embedded, is being sandwiched between these bones and muscles, and how different structures has been organized within its substance. You can see that inside the gland, we have these neurovascular bundle who are there, and on both the sides, front and the back, medially, and all the ways, we are looking at different important clinically relevant structure. They are closely related and closely packed. Now we are looking at this parotid gland. Obviously, it's a gland. So gland has a tube. This tube is the parotid duct, and this duct is going to the vestibule of my oral cavity, and it's opening at the level of the upper second molar tooth. It has its opening. So when we are ready for eating our food, so at that time, we all notice that we salivate. So much secretions are there, and they are helpful in digestion. Now you're looking at another view, and they are looking at how this parotid duct, it traverses and how it pierces. When it emerges from this gland, it goes over this masseter muscle, and then it is just been piercing the buccal pad of fat. Then it's piercing this muscle, which is called buccinator. And after piercing that, this is the oral mucosa. And then this area, this specific area where it opens in the vestibular cavity of my oral vestibule of my oral cavity, that's called the parotid papillae. Okay, going further, now we are looking at how the different structures we talk about these structures. You're looking at the facial nerve and its branches. Then you're looking at a retromandibular vein and how it's been receiving its tributaries and how it's been dividing. And then you're looking at the external carotid artery, which is coming from my common carotid artery. And this external carotid artery, it's ending within the substance at the neck of the mandible, and it's just becoming maxillary and the superficial temporal artery. So that has all been shown. So these structures are present within the substance of this gland. Going further, now we are looking at again how the facial nerve is going through this parotid gland and how everything is being organized here. Going further, now we talk about what is the nerve supply. Guys, the nerve supply of the parotid is really something where we need to be very clear about. So the story begins with, we should understand it's a gland. So it should have a parasympathetic and a sympathetic and sensory innervation. So this parasympathetic, so first of all, my area, you're looking at, this is my parotid gland. Now how this parotid gland is getting its supplies. So let's look at it. It gets its supply through aortic ganglion. When you guys are asked in the exam, you say it's innervated by aortic ganglion. Aortic ganglion is just a parasympathetic relay station. It's not a source. It is a station. It is a place where different nerve fibers are coming, parasympathetic, sympathetic, and sensory, and then they traverse with one common nerve. And that one common nerve who carries parasympathetic, sympathetic, and sensory component to the parotid gland, they go through the auriculotemporal nerve, which is one of the branch of my mandibular part of the trigeminal nerve. Let's see how this parasympathetic and what is the source of this parasympathetic. So to see that, we can see that inferior salivary nucleus. From there, we have a nerve, we have a fiber which is going to participate in a plexus. And from this plexus, we have a nerve which goes forward, and this emerging nerve, we call it lesser petrosal nerve. So this lesser petrosal nerve, it leaves base of the skull through foramen ovale to reach, to relay in the infratemporal fossa. It goes to the aortic ganglion, and you can see it has gone all the way down to go, and you can see it relays here. And these are the postganglionic fibers, and they are going towards the substance of the parotid gland. Now let's look at what is the source of my sympathetic. So if I have to look at my sympathetic, superior cervical ganglion, we all know the sympathetic chain ends in the neck as superior cervical ganglion, and from there the sympathetic fibers, they go over, they traverse across the arteries. So now from the superior cervical ganglion, you can see the sympathetic fibers, they have reached a plexus above what? What is this red structure which has been visible to us? This is my middle meningeal artery, is one of the branch from my carotids. So now you can see that there's a plexus which has been formed over this artery, and that plexus has a name to it. So this is a sympathetic plexus, and from this plexus we derive sympathetic fibers. Now you can see that these sympathetic fibers, they go over, they pass through this aortic ganglion, but they doesn't relay here. They go directly to my parotid gland, and they are carrying the sympathetic fibers. Now let's derive the sensory part. So auriculotemporal branch of the mandibular nerve, that is carrying general sensation. So it's bringing general sensation from the substance of the parotid, and they are also been traveling through this. And this is how if someone asks you what is the nerve supply of the parotid, you have to mention about parasympathetic, you have to mention about sympathetic, you have to mention about auriculotemporal division of the trigeminal, how from where we are getting sensory, from where we are getting sympathetic, and from where we are getting parasympathetic. This is really important, and I expect you should be spending good time in understanding these concepts. So let's now look at further, is this picture is further explaining how this tympanic plexus is being formed, and who brings this parasympathetic, which is coming from inferior salivatory. We talk about the glossopharyngeal caries. There are names for it. We are not talking about those. You can see the lesser petrosal passing through foramen veil, and then it's been sharing with that and whatsoever we have talked about. And you can see ultimately from this aortic ganglion. Aortic ganglion is one of the parasympathetic relay station, and from there we derive the nerve supply to the parotid, and you can see this is how it has reached to this gland, and this is how the secretions of this gland has been controlled. There is parasympathetic, there is sympathetic, and there is general sensation. So all is there. Now looking further, what are the structures which are under the skin and related to the superficial surface of the gland, that we need to be good at it. You can see that the same emphasis, but we have talked about the name of the structures who are related to my anterior medial surface, the structures who are related to my posterior medial surface. We need to look into these details. Nerve supply, we talk in detail. Again, if you need further explanation, you can refer this part of the slide, and I'm sure this needs to be really important, and we need to understand this is the C2 fibers. They are sensory to the parotid fascia, so that's a separate entity, and we need to be good at it, and that's coming from greater auricular nerve. C2 and C3 are component, and that's important, and that we should be knowing that what is the supply of the parotid gland and what is the supply of the capsule of the parotid gland. So these are two different entities, and we need to be good at these concepts. That's really important. Now we started our story with this gentleman, and you can see that. So now let's reveal. I hope you have gathered some answer, but if not, so let's take this help. This is Ferry syndrome. What's that? It's also known as auriculotemporal nerve syndrome. So after surgeries, after injuries, there are problems, and these problems, so what happens? So when these people, after having this surgery or after having any trauma to their parotid gland, when they have some food, when they eat some food, this area becomes, they start some secretion, some salivation. So these person, when they eat, so this opposite side becomes red hot and painful, and it is associated with beads of perspiration. So this is the gustatory type of sweating which has been emerging, and especially it comes when person is in the time of eating, and when these people shave, there's a cutaneous hyperesthesia in front of the ear. So these are the things which can come in some of the individual who undergo a surgery or who have a traumatic condition. Now, what are you looking at in this image? I know this is a child, cute child, but does he show some anomaly, some abnormality to you? Yes, I can see that this part is swollen. It is a little bit red. So what is that? It's a very, really difficult condition. It's called mumps. It's also called hamster face appearance. So what happens? This is a really a bad condition. Mumps, we need to be good at it. And this mumps is basically epididymoarthritis, and that's really important. It's one of the very painful condition. It involves parotid, and then on the other hand, it involves the testes, and this is really important. And if someone develops epididymoarthritis, there are fair enough chances of having problem with the spermatogenesis and all those things. We need to look back into those concepts, and that's really significant. And once we are looking for someone who present to us in the clinics with infertility, so history of mumps plays a significant role, and we need to good about how this mumps is affecting someone's fertility. So now these are some few summary slides which I kept there for your just connection, for your recordings, and for your understanding. And now guys, I think we are ending. We are reaching towards the end of this presentation. Thank you very much for your kind listening. My email address is there. I'm open for you. Just send me your concerns, any concern, any question which is not clear to you, anything which is bothering you, so I can be ready during the Zoom session, which will be tomorrow. So we'll talk about it. So thank you very much. Bye-bye. Take care.